facial treatment is. You know, this is more than just a facial. So treatment blending with Exion and EMFACE, lymphatic drainage.
Yeah.
We use our lymphatic drainage trousers. And then beyond that, we have my all-time superstar, which is Luma.
Oh my God, it even lights up. That's so cool.
It lights up. So 20 years ago, I did my master's in light therapies at UCL. So it was 20 years ago in 2004. So you study cell behavior, cell biology, and how it functions to cancer changes, as well as how we can regenerate. So this is it now, 20 years later. We've had this for 4 years in the clinic.
So beautiful.
It is actually beautiful
to watch.
Yeah, and I love it because it's flexible, it's shape-taking.
Yeah.
I can literally use it on any size shape face, and it needs to be really close to the face. So when we study Luma, we understand the optics of it, the wavelength of it, the fact that I just love it. It's fibrillating, you know, it's almost oscillating so that it's upregulating the mitochondrial function. So I look at it like
it's powering up the skin.
What better way to charge up their electric car, which is themselves?
Yeah. With this, and you can take this home. I mean, this isn't just something you do in clinic, right? You take it home, you lie on your sofa. It's the dream.
I take it on holiday with me because that's when I'm the most relaxed.
Yeah,
and
exactly.
Recently bought the full body version as well because I now think about the aging of the musculoskeletal system as well in the longevity patients. So if they can lie underneath it, get some rehabilitation from muscle spasm, muscle stiffness, pain management. It's just absolutely precious.
I think we're seeing aesthetic devices, you know, trip much more into that wellness and that well-being, you know, like you say, rehabilitation, recovery, stress, improve your sleep, your cortisol.
Everything.
It's all part of the same package. This is super cool. I also have to ask you about exosomes because I know you have a big focus on these at the moment and they are such a fundamental part of regenerative aesthetics. Where do exosomes fit into what you're doing here? You're obviously sort of applying them topically because they are a topical solution, essentially, how we're administering them. What are they doing for the burnt out, inflamed, red, tired, stressed, not sleeping patient?
There are a number of patients who come in pretty well as well. So
sorry.
We're picking
50% that are allowed to go straight to their filler.
You're right, but I think we assume we have to decide, right? Look, it took me a while to figure out the exosome thing. I'm never one to jump on trends myself. It takes me a while to understand the science behind that particular therapeutic because there are some of us who are really au fait in stem cell therapies, like many colleagues out there. For me, I like to learn about everything, so I take my time in studying what this means. What is an exosome? Because there's so many classifications.
Yeah, exactly. And there's so many varieties, and
I was confused.
Approved, and I think there's been a bit of confusion in the UK as to what's approved and what's not.
So it probably took me about 4 or 5 years to make a decision which one to settle in with. As you know, I have one skincare line out there for the last 9.5 years, which I love, which I trust, which I believe in, which gets me reproducible results. So I'm very assured by it. So to bring in the next version, I had to think really hard which one I'm going to bring in. But what I love about the study of exosomes is that you're looking at a stem cell product, which we know comes from us, and we're looking at what comes from the stem cells, which is growth factors and cytokines and proteins that are going to work within our bodies in a cell signaling type way. And it's all about cell biology to upregulate all of our systems. So there's exosomes everywhere. So, you know, if you damage lung tissue, heart tissue, there's going to be exosomes released in order to repair it. So if you take that analogy and just put it onto the skin, you should be able to replicate that analogy.
So they're these sort of repair messengers that work in a very bespoke way. They'll find the site that needs repairing that is unique to you, and they will go in and patch it up and
go in and get the job done.
Yeah, exactly.
So its signaling for you will be different to me, different to whoever that's out there. So you don't need to be bespoke to anybody.
Which is fascinating. So essentially you can sort of apply your topical exosomes and know that whatever condition the patient might be presenting with, they will get to the root cause of it and they will
do what needs to be done.
Amazing. It's almost like the AI of aesthetics.
I'm going to borrow that. I've borrowed that, everybody.
Well, they're doing the thinking for you.
They are. They're doing they've already done the thinking. But what I love about the study of exosomes that is working on the intrinsic of every patient uniquely to them. That's what I love about it. And it'll be interesting to see where that goes in the future of aesthetics. The study continues. And I know There's some colleagues out there doing some fantastic work on exosomes. So I look forward to hearing more from them too. But for my situation, I carry out a lot of treatments for inflammation and aging. So I'm always looking at what is the next best thing that can do a faster job, that's going to feel really good for the patient, and that we can use in other areas. So this is what XOE is all about, which is a plant-derived exosome-like material. 100 derived from stem cells from plants, brought about in the United States, created by a plastic surgeon from Beverly Hills. And I've done a lot of research behind it. I've seen their clinical data. I've spoken to their team of doctors over there, and the science is just incredible. Amazing. I feel comfortable with the fact that it's also a plant-derived system.
Exactly.
And that makes me feel that it's safe for my patients, safe for me. I use everything myself. And I think as soon as I felt it in February last year, I just knew I had to have it.
And so where are you most commonly applying the XOE exosomes?
So number one will be immediately for our RF needling patients. And it's a completely unique system because, again, the trend has evolved, and certainly in this system, it's evolved even further. So it's almost like one step ahead of the game. Most formulations, and I won't quote all of them because I may not know all of them, but most of the ones that I've come across with, it's do the injury and then put the material on. So we've already created the injury, but we're producing a response. And then the topical goes on. Or you might need to needle it in because the material doesn't have that degree of permeability. What I love about XOE is that it has a high degree of permeability because the cell wall of the plant stem cell membrane is the same as our cell membrane in our skin wall.
Interesting. So it recognizes it as almost like-minded material.
Correct. Almost bioidentical. Almost like for like.
That's cool.
So it's what we call a transdermal product. And when you feel it, you'll know. It just kind of goes.
So full face, sort of neck,
everywhere.
Sort of, after a full face of radiofrequency microneedling.
We actually use it before. So we use it for 7 days before because the system for 7 days before is all about autophagy. Autophagy is something that we now know is part of the 12 hallmarks of aging. See, we never knew these 12 hallmarks until a few years ago. We probably knew about 4 hallmarks of aging 9-10 years ago, one of them being inflammation, reactive oxidative stress formation, those kind of things. Whereas now we know there's autophagy, reduction in autophagy, which is the cell clearance. We also know there's decrease in mitochondrial function, a change in the microbiome, all these things that you've heard about when you interview my colleagues. But the one thing that we want to do is clear out the cells before we injure it so that we promote angiogenesis as well. Angiogenesis is where we improve the perfusion of the skin. When you improve the perfusion of the skin, guess what you're going to get? You're going to get a better healing. You're going to do all that. But
perfusion means?
Perfusion. And I love that because you're actually thinking of what you're going to do to the skin before you've even done it. So you're preparing the skin for 7 days, improving the hydration of the skin. And then when it comes to the actual day of treatment, we apply a stronger concentrate of the exosome material 15 minutes before the treatment. And that has been clinically proven to downregulate the inflammation by up to 61%.
How amazing. So you can still create the trauma necessary to stimulate the collagen and the fibroblasts and the hyaluronic acid, but you're just whacking down that sort of trauma and that redness and inflammation that comes as a result. So controlling the inflammation. So
you're controlling the bad inflammation by 61%. So the patient heals faster, there's less bruising, swelling, redness, downtime, down by 61%. And you're speeding up quickly to the good inflammation, which is the growth of the collagen and elastin and the growth of cell function. But interestingly, the other thing that the 7-day aftercare then does, it upregulates the elastin to hundreds of percentages up. So again, like Exion by BTL, you're seeing this elastin production go up.
Oh, that's incredible. So you layer up all of these technologies and the end result must be so beautiful. And I guess it has the same effect on the scalp, which is a new area that it's now treating.
Same effect on the scalp, slightly different version. As you know, everyone talks about the menopause now. And
it is happening for 50% of the population.
It's going to happen to all of us. So we know that we're going to lose hair. It's going to get thinner. It's going to get more brittle, more damage, more grey. And
even if it's not the menopause, it will be stress or it will be inadequate nutrition or
all of the
various things. Yeah.
So because we're going to lose that at some point, why don't we predict the aging? We know it's going to happen. Why don't we start a little bit earlier? And that particular system called Derived by Exo, can actually upregulate all of the good things, downregulate the inflammation. And it has something called cytokeratin 15.
Wow.
Cytokeratin 15 is really great to improve the hair follicle bulb. So it prevents dihydrotestosterone, which is the bad hormone that we get when we go through menopause. It prevents dihydrotestosterone from attacking it.
Interesting. So it's sort of created a little bulletproof sort of capsule around it.
Yes, it's like a Superman shield.
Yeah, exactly.
So I'm thinking if my dihydrotestosterone levels are certainly going to be increased over the next few years, I want to shield off and protect my follicles as much as possible.
Yeah.
Using a topical therapy, using the new facial called Aquafirm that we've just brought in as well, also a year this month. And that combination of the high-tech facial, the high-performance Exo for the scalp, Sluma Restore for the scalp, which is another version of this.
So beautiful. I think everything is sort of now focusing on the hair and the scalp, and it's so nice that it's not being forgotten about.
I know. So it's like the beauty triangle. You've got this beautiful beauty triangle, which is all about you, all about the audience. We've put your audience first, actually. So it's about your audience, your doctor, and it's all about the treatments, the technologies, the science that you've just pulled together in this fantastic audience within what you do. And I feel the same way about my profession in this clinic. It's like a triad. You've got the patient, you've got the practitioner, you've got the products and treatments.
Yeah.
And I very rarely do just one thing in isolation.
Yeah, exactly. You have to take that hybrid approach now, because also you've identified there are so many factors that we're up against, the perils of modern life, just being on constant burnout mode, cortisol levels high, not sleeping, wanting to be out there and achieving and performing, but at the same time, you need that hybrid approach to address all of those different things that the body is going through. We're so overwhelmed in a way that we never were before.
I know, but in a way, Francesca, I'm sure you would agree, we're striving for more in our lives. We want to achieve bigger, better things for ourselves, and it's not a bad thing.
No, it's true.
Women.
It's that sort of positive stress that I think you referred to earlier as well, for women and men. It's something that drives people and keeps them going and being productive and gives purpose often, and that creates happiness when we feel like we're purposeful. But I think it's ensuring that you have the right modalities, technologies, approaches that actually support us. Life is going to change. It is going to be busy. We're never going to eliminate stress entirely from our lives. And maybe that's a good thing in some ways, but we just need to make sure that what we're balancing it with is actually going to support us and do the right things for us. I think it's why this field of medicine is absolutely fascinating. It's just so interesting to see it grow and sort of all the different directions it's sort of spiraling off into, but then at the same time how people like you are bringing it all back together and sort of always, finding the best balance for the patient as well.
Well, it's a fascinating space. As I said, it's a privilege to be a part of, and to bridge the gap between science, medicine, tech, research. All skin ages, all skin types, male to female, top to toe. So I think I'm super grateful that you've pulled us together today, that you brought all the clinicians together in the beauty triangle, because it allows all of us to learn from each other. It also allows the bigger population, not just in the UK, but internationally, to learn from your panels as well. And I think it's a great idea.
There's a lot of power in that sharing of knowledge, and it's been so wonderful to have you sort of open up sort of your clinic and your brain and sort of listen to all of your wonderful ideas and take on board all of your sort of understanding of regenerative medicine and where it's going. So a huge thank you for having me, and it's always such a treat to come to Beaconsfield, and lovely to see you as always. And for everyone watching, that was a huge deep dive into regenerative medicine, age management, the future of human beings in many ways, physically, emotionally, mentally, like we discussed. But it's been really, really eye-opening for me. I hope it's been helpful for you. And anything further that Sherina possibly, I think you've answered everything that we might need to on the subject, but anything else you need to know, we're always here. We can always connect you. And thank you for watching. And thank you, Sherina.
Thank you, Francesca, for the opportunity. Thank you, everyone.
See you next time.